Assalamualaikum, my name is Muhammad Muammar Mukris bin Majid, and for this video I will explain about the MCU. MCU is the micturating cystourethrography, and where it is an X-ray examination of a bladder's filling and emptying. It examines if urine is moving backwards from a bladder to the kidney. So, anatomy of the genitourinary system is there are a pair of kidney, which is right and left, hepatic vein at the superior of the both kidney, inferior vena cava, where is bring a blood to the heart, adrenal gland also above the pair of kidney, at the lateral larger vein and artery there are two ureter. So why we need to do this examination? Because we want to indicate the pathology. Initially, a vesical urinary reflux, they are commonly occur at the children. Next, we want to indicate the urinary tract infection. Furthermore, is the stress incontinence, where the muscles that control the release of urine become weakened. Moreover, urethral dysfunction, on which is the lack of the muscle bladder and urethra. For patient preparation, as a radiographer, we should explain the whole procedure if a patient is old enough to understand. Next, the patient need to wear a hospital gown, and we need to remove their clothes. Ask the children if any allergies toward the contrast media. So basically, this procedure done with a children and 6 months or younger. So you don't need to ask their last menstrual periods. During the procedure, give us some medicine for a sleep if they can't cooperate, such as give the nitrous oxide. Moreover, parents are encouraged to help a staff so their child are not in an anxiety state during the catheterization. We must put lubricating gel so patient will need feel uncomfort. At last, bring the toys or the comforter so the pain and the uncomfort feeling will become less. The radiographer and the parents, they need to wear a gonad shielding, leg gown or abdominal shield. And for the patient, just shielding the area that doesn't involve. For the procedure, nurse will clean the urethra hole for avoid any infection. Patient in the supine position and the catheterization will start. Then the contrast will be injected and the contrast will be seen in the X-ray. Then we need to shoot and record. Then ask the child to the roll slightly to the oblique position, which is right or left with knee and hip flex. Once the bladder is full, the child need to clear their bladder, and this time we should record. We should record for they indicate any reflux or obstruction. The post-micturate also need to be taken in the KUB concept. After that, after the procedure is done, we need to inform the patient so they can go back to home and must drink a plenty of water. Physician will inform the result after patient back at their home. Their parents should call the doctor if the child have a difficult to pee. We also need to tell them that the urine will little bit pink due to the catheter. This image shown a normal MCU, which is the film is taken in the KUB in the supine position. The density and the contrast also in the optimum state. There is no reflux occur. Meanwhile, the diagnosis for this peak show an abnormal MCU, where the vesical urinary reflux commonly happen in the children. The dye contrast visualized they are flow back from the bladder to the kidney. At last, the result for this image will be informed to the patient and they will pursue for other treatment. That's all from me. Thank you. And here is some reference that I found in this procedure. Thank you.